My name is Aimable Uwimana. I'm a global public health practitioner based in Rwanda, with experience in community engagement and development, addressing social determinants of health, and also in health promotion, and as well as physical activity advocacy. And in physical activity advocacy, I mostly engage in promoting physical activity as a way of prevention and management of NCDs. I am the founder of Mugenzi, whose mission is to create physically active community that is engaged in breast cancer awareness, advocacy, research, and social support through walking, hiking, and biking 1,000 Hills of Rwanda. And I also lead all public health promotions campaigns at Mugenzi. I am also a proud and grateful member of the Engage Africa Foundation, where I volunteer my time and expertise in policy research and health advocacy. And in today's masterclass, we are going to be discussing or talking about hiking and biking for health in Africa. And looking back, I would say that during my studies, my undergraduate studies in healthcare management at Southern New Hampshire University, particularly undertaking global public health module, I was able to gain insight into the global burden of diseases, where I learned about how globalization, demographic shifts, changing lifestyles across the world has contributed to the increasing global burden of non-communicable diseases. And also I was able to learn about how the NCDs were less funded when it comes to preventive and management intervention compared to infectious disease like HIV and TB that has got so much support from like global AIDS movement or even global fund success. And this experience in general helped me to understand the importance of physical activity, mostly in prevention. And it helped me to recognize how physical activity is a significant contributor to preventing and managing non-communicable diseases, and how it helps generally reduce symptoms of depression, anxiety, and also improve the overall well-being, as well as enhancing thinking and learning skills. And along this journey as well, for a half decade, I would say that as a physical activity advocate, I admire my country, Rwanda, that has been responsible in putting to life initiatives like Kigali Car-Free Day. Kigali Car-Free Day have been one of a kind twice monthly event held for the first and third Sunday of every month. And on this day, like several roads are blocked off for people to run or cycle or walk, whatever it is they want to exercise in, without interference of from motorbikes or vehicles. I believe you know that Rwanda is one of the countries on the continent with so many motorbikes. And in addition to this aspect of promoting physical activity, Car-Free Day has been a platform for NCD awareness as well as screening, where since 2016, when this initiative started, we've been able to see a great impact it has brought, whereby actually 48,000 has been screened for NCDs, and among these ones, like 23% were found to have high blood pressure, 9% being having high blood sugar, and also 11% of them being obese. And you could see how a government is involved in leading these efforts to make sure that people are physically active, healthier, and also know their status and how they can manage this. And these events of walking, hiking, or even cycling has been helping in this. But also, not only that Car-Free Day helped in that arena, but also it is an opportunity for the country to reduce emission of the carbon dioxide that pollute the air and changing the weather and climate, everything around climate change. And when we see the impact the COVID-19 pandemic had brought to global health and well-being, there have been a significant global increase in anxiety and depression, and some studies actually showed that COVID had an overall negative impact on physical activity. And from my experience in Rwanda, you could see how Car-Free Day was put on hold, why it used to be one of the venue where people not only exercise but like build relationships and friendship. But in some countries, like in Nigeria, we have learned actually uh, witnessed some of the social action for health initiatives that brought people together and served as a coping mechanism. An example would be the Hikers Trail in Nigeria that brought some of the organized hiking events or exercise events. And this could help as a coping mechanism against pandemic-induced mental health challenges like anxiety, and also it being a place where people made for physical activity. It also remained as a platform for remaining mentally healthy, if I would say, and this could serve as a benefit of hiking for health in Africa. And reflecting on this and also my experience, I would say that before COVID, I was already a physical activity advocate, and my passion, though, grew even stronger during COVID. Why? When I was pursuing my master's degree in global health delivery at the University of Global Health Equity, with a focus on breast cancer awareness and early detection in Rwanda. And to complete my thesis, my research in these trying times, I would say that I found therapy in activities like walking, hiking, and biking, since most of the activities that were social were reduced. So I would do this alone, and it ended up helping me to the extent that I was able to establish Mugenzi with hope that we adventure with purpose. And my experience helped me understand the importance of remaining physically active. Not only that it helped me during my studies in such trying time, but also after graduation it helped me with when I could burn out at work. We are always sometimes busy with work, with projects. And I would say that I have found a remedy in hiking and also cycling. Until then, this grew more to where I established Mugenzi with this mission of creating a physically active community. Not only me or only doing this, but also growing the community that is engaged, of course, in my areas of interest, and also a burden that the country is having of cancer awareness, research, advocacy, and social support through walking and hiking and biking across 100 hills of Rwanda. And I would say that since 2021, Mugenzi has already organized 15 hiking adventures in the national park. We have some beautiful mountains there like Karusimbi, Muhabura, Sabyinyo, and Bisoke, but also another tropical forest called Nyungwe, and also just around where I'm based at work in the Butaro and Twin Lakes, Ruhondo and Brea Lake. And organizing these events has not only helped me create such a community that is physically active in hiking, but also we've seen some of the networks coming from there, and also people loving it since it could help them not only in such way, but also connections and also take care of their mental health. And I will add that yes, Genzi had also planned 3 mountain biking adventures that focus on breast cancer awareness. Like one was in October 2022 during the Breast Cancer Awareness Month, and also another one in February 2023 for Cancer Day, and also recently in July, that was Congo Night Trail, almost the whole western province of the country. All of these were just to raise awareness on breast cancer, but also remaining physically active. And I would say that all these adventures, the hiking and biking adventure, has involved over 100 participants and all aimed at promoting physical activity and also raising awareness on not only breast cancer but also other non-communicable diseases. And I have also published 3 articles discussing the physical activities, cancer awareness, and advocacy in Rwanda, and they are published on my blog of Aimable Rights, blogspot.com, where like one talks about nature photography being a therapy during the episodes of pandemic lockdowns and curfew, and another one why I advocate for cancer patients as well as an open data to my dearest cancer patient across the country or the world. And all of this experience, I would say that through these 3 years, I have learned that Rwandans have embraced hiking and biking as part of their physical activity lifestyle, and also to prevent NCDs such as hypertension, diabetes, and breast cancer, since research has proved it to be connected. One of the favorite research I would say is Daniel Lieberman from Harvard, who is focused on this. And I can count even more than 5 groups that are on mission of hiking all the 5 Rwandan volcanoes. And these not only serve as a means of maintaining like mental health, well-being, because of their busy work and busy schedules, it also serves as a way of forging networks and relationships. We can celebrate all this progress or acknowledge them without talking about the enablers that actually support physically active lifestyles in Rwanda, and the major one being community and leadership ownership, where we have already learned about some of the communities that have created some of the hiking trails that are free of charge. And this offers everyone the opportunity to explore nature and Rwanda's beautiful hills while staying physically active. And one of the major or prevalent team in Rwanda or Kigali, I would say shout out to the A team. It's a hiking team in Kigali that hikes every Saturday in Kigali and across the district that are close to Kigali. And it invites everyone, it's open to everyone, everyone can join free of charge. It's just that they have such passion or such time to hike every Saturday. And this is contributing a lot on this culture of remaining physically active while also leveraging relationships and remaining close to each other. And also government has been actually investing in making some of the community hiking trails that are free of charge, or you can talk of, or even car-free zones around various places in the city, and also various destinations that help people to remain physically active. And another one that helped these efforts is the green revolution that the country has been investing in, where we see it, the Rwanda's conservation efforts that recover some of the marshlands and make them beautiful eco parks with walking and cycling facilities. A good example could be Nyandongo Eco Park in the city of Kigali. That used to be an irrigated marshland and now has been turned into a home of endangered species like trees and birds, but also with facilities that facilitate walking and hiking around there. And this come to contribute or to complement initiatives like Car Free Day, where people have a destination of where they can go and hike, I mean like exercise, cycle, and do other physically activities. And the last one, which was also good, is called urbanization. The country is fastly developing. I think you know that. If not, please come and visit Rwanda. And in this, Rwanda is focused in building safe roads with biking lanes, proper signage, and cyclist-friendly traffic planning in a way that people are able to remain physically active while even using the public roads. Like one of it, like will be from my experience when I recently was recording the episodes of cycling 1,000 hills of Rwanda, specifically on Kigali City Bike Tour series, where I was impressed with how most of the new roads are being built with an inclusion of people who are pedestrian, like cyclists, people with disability who need wheelchair ways, and so many other people. And this is so great to see a government involved like that. And also, this goes with also some of the cyclist-friendly places where people are able to cycle alongside with the cars, and then there are no traffic or accidents, or they are reduced. And we would say that even though these enablers are here, we still have a long journey to go, even not only in Rwanda, but also across the continent. And with some of the areas of improvement everyone can recognize in their communities, feel free to comment them here. But I believe that the future of physical activity in Africa and the world looks promising. Um, we hope for physically active communities with interventions supported by the governments and the communities themselves, but also with adequate funding for policy and governance in this arena, as well as public awareness campaigns and global collaborations that contribute to addressing NCDs through physically active communities, and also addressing other non-communicable diseases risk factors. And I hope you take up your efforts to join efforts together with your communities and contribute to this movement. And I extend my gratitude to all of you participants in this festival, especially on this masterclass. And I believe that to achieve healthier and happier communities, we must just walk the talk. Yes, there is a global burden, but what can you do in your risk efforts, like in your risk resources? And I also believe that we need to advocate for physically active communities through localized and research-based interventions. And in that, I invite you all to be Mugenzi of Nigeria, Mugenzi of Malawi, Mugenzi of Zanzibar, as you create a physically active community in your home, as we are doing here in Rwanda, and promote a healthier Africa and the world. And I feel like time is better being now, so that we embrace safe walking, safe hiking, and safe cycling for a healthier future. And I can't wait as getting something out of this as the continent, as the world, while addressing the global burden of non-communicable diseases. And if you want to continue this conversation outside of this, you can check my socials as I am Genzi on social media, either Twitter, LinkedIn, YouTube, Instagram, and we can continue this conversation. And also kudos to the Engage Africa community. I feel like also keep connecting with us as we forge these efforts to have a healthier Africa. So thank you for staying here all this time, and see you or let's connect on other platforms.